Hi, my name is Nilay Patel, and I'm one of the chief medical residents for the Department of Medicine and one of the inpatient attendings in the Department of Medicine. Over the past few years, there's been an increasing concern about the care delivered to septic patients. We've learned that sepsis is a leading cause of inpatient mortality, accounting for more than 1.5 million hospitalizations and over 250,000 deaths per year. While there is no simple test to diagnose sepsis or a single therapy to reverse its harmful side effects, research has documented that rapid identification and treatment can save lives and reduce long-term impact on survivors, which has spurred regulatory efforts to protocolize care. MGH is committed to improving the timely detection and treatment of sepsis. Through a collaboration with Partners Hospitals and the Partners eCare team, we are working to build knowledge around the condition, treatment expectations, and resources to support safe and effective sepsis care. One such resource is a new EPIC best practice alert, also called a BPA, that analyzes elements in the electronic chart, such as vital signs and cultures, to flag patients who meet the criteria for possible sepsis and septic shock. The Sepsis BPA provides real-time decision support mapped to the clinical stages in the Partner Sepsis pathway, our gold standard for sepsis care. We just finished piloting the BPA with more than 100 responding clinicians and nurses across MGH, and after making several improvements based on their feedback, are preparing to launch the BPA on February 21st. Trish, you've been a key contributor to the creation of the pilot for the BPA. As a nurse in the Department of Surgery, how do you see the BPA impacting your day-to-day workflow?
So the alert will help bring possible sepsis to our attention and encourage timely communication with responding clinicians. It will ensure that everyone is aware of the patient's condition and that the appropriate actions are taken place. The BPA has been purposely designed to identify high-risk patients in order to prevent overfiring, but it does not mean that you stop using your clinical judgment. It is important to remain vigilant. If you're worried about a patient, don't wait for the BPA, contact your responding clinician.
Excellent. Dan, you're a resident in the emergency department, which is one of the areas where the BPA will be working and active. Could you tell me where else it would fire and how it'll impact your day-to-day workflow?
Sure, Nilay. The BPA is configured to fire in the ED, but also on all adult inpatient floors, except for the ICUs and the ORs. It will prompt providers to consider a diagnosis, and if we deem appropriate, enable us to add sepsis to the problem list with just a single click. It also provides a shortcut to several tools to help monitor and manage septic patients, such as the sepsis order set and flow sheet. I anticipate that the BPA will help us manage septic patients, increase the use of these tools, which are already live in EPIC. I should note that the alert captures vital signs that are abnormal, that are a warning sign for clinical decline, not necessarily sepsis, to include things like pulmonary edema. So in summary, I think that the BPA will help bring sick patients to our attention sooner and ensure that we as responding clinicians are providing standard and timely sepsis care when it's appropriate.
It sounds like the BPAs will help to strengthen the clinical response to sepsis and communication tactics. Thank you both for your leadership. As I mentioned before, the go-live date for the BPA will be Wednesday, February 21st, and the entire care team will be expected to work together to respond. We appreciate your hard work and are interested in your feedback as the BPA rolls out across the institution. There will be a hyperlink in the BPA to submit comments on its behavior and technical design. If you have questions or feedback on the clinical workflow, please contact the sepsis champion in your care group. Thank you in advance for your